This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this week, well, I have a pal who is a regular listener of the program, and at one point he said to me, you know, you talk about breast health quite a bit on the show. You might just consider calling it Focus on Your Breasts. All right, well, if you're daring me, this is the special edition. This is Focus on Your Breasts. I have cut together excerpts from some of my favorite guests who have come on the program to talk about breast health, mammography, breast tomosynthesis, the importance of catching breast cancer early. It's a pretty cool cast of characters, and I hope you'll enjoy. Let's begin with Dr. Christopher Johansen. He's the Director of Breast Imaging at the KRMC Imaging Center. Can you talk about the importance of catching breast cancer early?
That's amazingly important. The benefit from mammography and just in general from breast exams, anything like that, all comes from the fact that smaller breast cancers are easier to treat, they're cheaper to treat, and we have better success rates. So for instance, if you have a stage 0 breast cancer, something called ductal carcinoma in situ, it's basically the precursor to an invasive breast cancer, and you treat that effectively, you'll have a cure rate that is incredibly high. The life expectancy of that person will be as close to unaffected as any doctor will ever say. Unfortunately, if you have a stage 4 breast cancer, a cancer that's already starting to spread outside of the axilla, the armpits, and the breast, that cure rate drops essentially to 0. Wow. At that point, you can use all sorts of really intense techniques like chemotherapy to fight a rear guard battle. And then everything in between those two falls somewhere in the middle. You have to use some of these advanced techniques. It takes longer to fight, and we don't do quite as well. So the earlier that you can find breast cancer, the better off you are in basically every way we can measure.
Right.
Mammography's big advantage is that it can find things when they're particularly small. Before you can feel them on exam, before you can see a difference in the breast, it can find things that are very amenable to treatment.
And you never go to bed one night and wake up the next morning suddenly with stage 4 cancer. You know, this is something, what I'm saying is if you're taking care of your yearly mammograms.
Well, I won't say, no doctor will ever say never. Mammography will catch about 90% of breast cancers.
Okay.
There are unfortunately a few very, very difficult to see breast cancers that can remain occult. They can remain not seen on mammography. 90% is pretty darn good. There are other techniques that we can add, especially in cases where we know a woman is at very high risk, like breast MRI, that will increase that sensitivity and allow us to catch the vast majority of those remaining few cancers that evade our detection on mammography. Some cancers will grow much faster than others. You'll not go to sleep one night with no cancer and wake up with stage 4, but some cancers can go very quickly. They can go from a point where literally the first physical symptom is a stage 4 breast cancer.
Wow.
It's unusual to have someone who's being screened yearly with mammography get to that point, but not impossible. Right. It's important that we don't oversell mammography. It's an incredibly useful technique, but it's not a silver bullet that will catch every breast cancer and eliminate morbidity and mortality from breast cancer. But it is, without a doubt, the best tool we have and the most effective tool we have to make sure that as many women survive breast cancer as possible.
It seems safe to say, at least, with regular mammograms, with knowing your risk in terms of your biological, genealogical history, with being aware of what's going on with your body, and of course, health, exercise, right?
Right.
If you do these things, you can certainly slant the odds in your favor.
Absolutely. For the typical woman who doesn't have some sort of unusual genetic syndrome or incredibly strong family history, the absolute best thing you can do to avoid dying from breast cancer is get a yearly mammogram.
Next up is Sharon Kolb from Susan G. Komen, Central and Northern Arizona. Here she's talking about breast density.
Know your risk, get screened, know what's normal for you, and make some healthy lifestyle choices. And when we talk about some of those risk factors, we talk about the topic of breast density and how it might affect your breast cancer risk. In October of 2014, Arizona joined about 20 other states and passed a law stating that women will be notified if they have dense breasts going forward. So women can expect when they get that report from their imaging center that if they have density in the value of 50% of the breast by volume is dense tissue, they'll be asked to talk with their doctor about the best screening method for them. So when we talk about breast density, we're talking about volume of the breast compared to fat as compared to breast density in that dense tissue. And that has two effects. One effect can be a masking effect. So on a mammogram image, which is an x-ray of the breast, and that's meant to catch cancer before it can be felt or seen, it's important to know that that masking effect can delay detection of breast cancer. So women who have dense breasts are encouraged to talk with their doctors about the best screening options. And that takes into account about 40% of women. So it's not uncommon for women to have dense breasts. Now, a lump is often associated with breast cancer, but that's only one warning sign. There are 8 major warning signs. 6 of them are visual. So we want women to be aware of when they're getting dressed, getting undressed, showering, daily activities, that if they see any other signs like dimpling or puckering in the breast, or if they all of a sudden see swelling or inverted nipple, warmth, redness, swelling, these are all signs that they need to get in and talk with their healthcare provider about.
In this next clip, we'll hear from Jennifer Rosebrock. She's KRMC's breast health navigator. And here she's talking about the positive diagnosis and following up on it. Do you ever get women who have a positive diagnosis and just say, I don't want to follow up on this, I don't want to be treated?
Very few. It does happen.
Yeah.
It happens more before there's an actual diagnosis and there's just some kind of suspicion and women saying they don't maybe want to know. And a lot of that comes from fear and denial. And I have seen, a couple women that have had a diagnosis and not wanted to do anything about it. What we really try to do here is to educate on the benefit of catching a breast cancer early.
Right.
If women do their routine screenings, and get in a timely fashion, the sooner we catch something that does develop and they've not done anything to develop that breast cancer, not their fault, it's just something that happens, the sooner we catch that for them, the better the outcomes are for the patient. The more options there are, the less harsh treatments there are for a patient. And so, that is not uncommon to have some fear and some denial about even going through the workup process itself. We see that, but we try our best to educate and emphasize, that we have support for you. We are very fortunate here in Kingman to not only have wonderful screening and diagnostic services for breast cancer, but also treatment. So our surgeons and our oncologists here in town, people don't have to travel outside of town if they don't want to do that, and that's not the same for every community. There are some places that don't have that option, and so, letting people know that they have the support and providing them with education so they make an informed decision is a big part of my role.
This next clip is with Teri Williams. She is with KRMC Public Relations, and here she's talking about free mammograms at the hospital.
What we are offering at KRMC is to across the board free mammograms. So what we mean by free mammograms, that if a woman has insurance, we'll definitely bill their insurance. However, if they have any out-of-pocket costs, we'll cover those out-of-pocket costs either through our Kingman grant, if they fall within certain guidelines or income brackets, or with other catch it early funds that we get through the community. Or we first try and qualify. If they qualify for state Medicaid or access, we We have representatives here that will help women get signed up for that, and then they do have insurance for a host of medical issues or screening or whatever. Or we work with another program called the Well Woman Health Check program, and so one way or another, we're going to get the help that woman get the best coverage they can for their breast health, but then for their health in general. And of course, no out-of-pocket costs for a mammogram. And it's just that important. And we see that as so important in Mojave County. We have one of the highest death rates from breast cancer in the state. And it's because women are confronting a bunch of barriers that are keeping them from getting in and getting those mammograms. So with this program, we're tackling all those barriers.
For more information on free mammograms, please contact the KRMC Imaging Center at 928-681-8600. That's 681-8600, and I will give that number again at the end of the show. Right now, time for a quick break, and we'll be back in just a moment. This is Focus on Your Health. Stick around. And welcome back to Focus on Your Health. It's brought to you by Kingman Regional Medical Center. I'm TG LaFredo, and if you missed it at the top of the show, I said that a friend of mine challenged me to change the name of this program to Focus on Your Breasts. So that's what I've done, at least for this week. This is the Breast Health Special Edition. Next up is a visit with Maggie Willis. She is the lead mammography technologist at KRMC's Imaging Center. Here she talks about what patients can expect on a visit for a mammogram.
So when they come in and they are being greeted friendly by our front desk receptionist, then they automatically become very relaxed, knowing that they're in good hands. And then the receptionist basically check on their information, demographics information, and insurance and all that. And that only takes a brief 3 to 4 minutes time. And then patients are told to have a seat while the technologist is getting their room ready back there. And then the technologists come out to the main lobby and greet them and take them back to individual modality areas. So the mammo ladies will be coming back to the mammo area, and we take them to a dressing room area, and that's where they prepare themselves for the exam. They're going to take their clothing off and whatnot and put on a gown and so on and so on, and then we take them to the exam room and do the exam.
I came in once for an interview, and one thing that struck me was I was sort of the lone man on the floor, and they said, okay, make sure wait, just stop here. We're going to go around the corner. We're going to make sure everything's all clear before you proceed. And it was clear to me that privacy is so important here.
Yes, absolutely. We really honor that, because most women, when they're in a gown, they feel like they're being exposed to the world already. So having the opposite sex in the room, that tends to make them a little nervous. And I'm just the opposite. No, just kidding.
Oh, Maggie.
Edit. But I think due to the courtesy for most of our patients, we adopted that policy in our facility.
Here is Dr. Christopher Johansen. We heard from him earlier in the program. In this clip, he's talking about breast tomosynthesis and the importance of technology in catching breast cancers.
It's been great to get the kind of support that we get from our hospital. The example that really sticks out in my mind is breast tomosynthesis. That's a technology that was approved for use in the United States in 2011.
Let's define it. Can we do that?
Right. It's an improvement on the basic mammogram. Traditionally, a mammogram is a 2D picture of a 3D structure. It's like a painting you would see on a wall, and even though you know that it's of a 3D structure, you have to kind of make that part up in your mind, and that's difficult, and that leads to a degree of uncertainty and error. That's one of the reasons that mammography didn't find 100% of cancers and sometimes called people back for further evaluation when there was no cancer. Tomosynthesis takes us a large step towards eliminating those two problems. It allows us to see the breast in multiple 1 millimeter slices. It takes the study that used to be 4 two-dimensional pictures and turns it into 200 or 300 pictures that we can look at and sum up in our mind to get a 3-dimensional representation of the breast. When this technology started, there was no reimbursement for it. It was expensive to implement. It took a lot of physician time that was, again, absolutely unreimbursed. When I wanted to bring it up to our hospital administrators, I had some trepidation because they're the ones responsible for the books, and it's hard to find a group of administrators to whom you can say, the only advantage to this is it's good for patients. It will lose you money. It will cost you hassle. I have no idea if it will ever be financially beneficial to you at all.
But we should do it.
Right. But I can guarantee you 100% it is great for patients.
It's like a kid going in front of his parents. You really should buy me this. I'm not sure what's in it for you.
But. Right. But I would really like this. And I expected, I had all my arguments ready, all my research and things to convince them. And all they asked was to confirm that it was good for patients, and that was the end of it. And it was purchased, and we became one of the very first places to use it in the country. We were the second place in Arizona. We missed a fancier place in Phoenix by only a couple of weeks to be the first people in the state to use it. We've used it ever since. We bring it to all people. We screen everyone with this technology. It's really been amazing to get to apply it to our population and see all the benefits.
How have you seen the difference then in applying it versus, if you didn't have this technology?
The major benefit, and that's borne out by both our personal experience here and the literature at large, is that you call fewer people back. So when someone has a mammogram that's abnormal, it's more likely to actually end up being a cancer. Now, because breast cancer is so easily treated when it's caught early, we still call back a lot of people for further views and even biopsies that don't end up having breast cancer, just because even a small chance of finding an early cancer is hugely advantageous in terms of making it cheaper to treat, making the treatment more efficacious, and allowing us to use less drastic techniques. No chemotherapy, for instance, when we find breast cancers tiny. That being said, we still want to minimize that. That's stressful for patients. There's economic and time costs. We don't want to do that if we can avoid it. This technology has allowed us to really reduce that. Right. And there are cancers that you simply can't see on 2D mammography that we are able to see on 3D tomosynthesis. They are not very common, thank goodness, but they do occur, and we can catch those.
One thing I talk often with physicians who have a lot of technology around them, and I ask, if you didn't have this technology, if you had to go back in time in medicine, where would you be? How would it affect? I mean, so you have a mission. You would still continue to do that mission. You would be compromised by losing some of these very valuable tools.
Absolutely. It's great to have tomosynthesis. We could go back to 2D mammography. That still gets you a lot of benefit.
Yeah.
If tomosynthesis wasn't available, I would still be using 2D mammography because I know it's still hugely beneficial to women.
Right.
But if I had to understand that 3D was out there and we couldn't use it, that would be suboptimal. It'd make me a little bit sad. Suboptimal to say the least.
Yeah.
Both because I know my patients, I would be very sad if I ever missed a cancer simply due to not having the technology to see it.
Right.
Plus, there's just the personal, professional satisfaction of knowing that the things you're doing are the same things they're doing at the most famous places in the country and at the biggest, most advanced, or richest places in the country. They get the same things that we do. Yeah. It's nice to be on the cutting edge right there with them, especially in Kingman. Unfortunately, a lot of times, Kingman doesn't get all the same things that these bigger, richer, fancier places get. So there's a little bit of me that likes to smile and think, in this case, it's the same here as it is in New York or San Francisco or Dallas or wherever.
Next up, we'll visit again with Teri Williams from KRMC Public Relations. In this excerpt, she talks about her own experience with breast cancer. On a personal note, as you've told me before, your mother's a survivor of breast cancer.
Yes, my mom was diagnosed probably about 25 years ago, and she's still alive today, doing great. And
I talked to her this afternoon.
Yes, you did.
Yeah.
And the reason why she is because in her case, they did find it very early before it had a chance to spread outside the breast. Her surgery and her treatment were very minimal.
Yeah.
She never missed a beat. She was healthy. And I can remember going through that experience with her, and this was my first experience with breast cancer, and that's really stayed with me, because what I thought it was and what it really was were two real different things. And if it wasn't for that experience, I don't think I would have had near the insights that I had. And I just think of other people that are out there that may not have a close relative or somebody that they know that they've been through it. And again, it's easy to be caught up in the myths. And I guess the greatest myth is that cancer is a death sentence. And it just isn't. It's very, very treatable, and especially, and it isn't just breast cancer. Every cancer, if you can catch it while it's still small and confined, with modern medicine, we can treat almost all cancers at an early stage, and the prognosis for survival is very, very good. And my mom's one to testify to that. And then just as so happens, 20 years later, after she was diagnosed, I was diagnosed.
That's right.
And same story, same situation. I was in the right place at the right time, and they found my cancer early.
You didn't detect anything funny on your own. It was just a routine check for you, right?
Exactly. Yeah. And that's the message, is that no, it was by the time you notice symptoms on your own, or even by the time your doctor with breast cancer notices a lump that you can feel, and if it is cancer, then often that cancer is pretty advanced. What the whole idea and why we call it catch it early is that you want to catch it before you can notice symptoms, before you're sick, before you feel it, in that case, because what cancer is it's cells growing out of control. If you catch them when they're still in small growth before they've spread, then a lot of times they're isolated to that spot, and you can treat that spot. What you don't want to happen is for the growth to happen to a point where cells get into the bloodstream or into the lymph system, that it spreads to other organs in the body. The more that it spreads, the more complex, obviously, it is to treat. So you want to catch it early. In my case, that was exactly what happened. They caught it early. The cancer cells were still confined to my breast. The treatment was, I didn't have to have chemo. I didn't have to have treatment that made me sick.
You didn't even miss any work.
No.
That's crazy.
I didn't have to take a day off work.
Yeah.
I didn't really have anything. I mean, it's not fun, and it certainly does some trippy things to your head as far as, wow. You know, when you're told you have cancer, it's pretty mind-blowing, earth-shaking, life-changing. And yet, to go through the treatment, and be here today to talk to you about it, it's such a blessing.
And that's the show. That is Focus on Your Health. This week, Focus on Your Breasts. I took you up on your challenge, Mike. There you have it. Ladies, if you are overdue for a mammogram, please call the KRMC Imaging Center. The number is 928-681-8600. That's 681-8600. And, ladies and gentlemen, thank you for listening. I'm TG LaFredo, and I'll catch you next time.